Good morning. Thank you for attending. Today I'm going to talk a little bit about our new state-of-the-art quality control laboratories that we have both here in Houston and in Costa Rica. So we all know that there's actually many parameters that embryos are sensitive to. So for example, pH, temperature, even the chemical compositions of the media, they can all have some effects on embryo development. These variations obviously influence the outcome of a successful IVF cycle. And so today I'm going to talk about some of the mitigations that we use in our quality control laboratories to ensure that the products that you're using are actually going to give you the most successful outcomes. So there are a lot of things that we do in a quality control laboratory to ensure that the product that you're using will result in success. So some of the things that we do is what we call raw testing material, and that's where we actually will do some quality control in the raw material that comes into the laboratory. So for example, if we get a new lot of sodium chloride, we actually assess the quality to make sure that it can be used in the future media production. We also do lab consumable testing. So for example, any new pipette tips, any petri dishes that come into the laboratory get tested either through many of the different quality control aspects, so whether it's a mouse embryo assay or a sperm motility assay, so that way we can ensure that that lab consumable doesn't impact the actual testing results. We also do what's called in-process controls, and that's actually all of the quality control steps that are being done when the media is actually being produced. So for example, when a new batch of media is made, we will actually test pH during the actual build process. We'll test osmolarity, and then when the finished good is actually produced and bottled up, that finished good then goes for a second QC in our quality control laboratory. We do also environmental monitoring and sterility testing. So what that entails is that during the whole media production, we are actually and actively testing the environment that the media was exposed to. So when we talk about environmental testing, we're not just talking about the actual environment, so like the air quality and so forth, but we actually do testing of the technicians. So we do what we call testing of their high touch points. So that includes the scrubs that they're using or the gowns, including their gloves and so forth. So those are all actually tested as part of the environmental monitoring. Obviously, water is an important aspect, and I'll talk a little bit about that in the next slide. And then we do what we call final testing product, and then that's kind of the most important, and that's where I'm going to focus the rest of the talk about, because that's generally after everything has been packaged. That's the QC testing that we do to ensure that the product is safe before it's actually released for the final use in the laboratories. And then one other thing that I want to talk about is what we call stability testing, because I think a lot of people don't realize that this is done. So stability testing is where we retain samples of the finished good. We store them at the appropriate temperature, but then we go back and we routinely test it. And the main reason for that is to ensure that the product is stable and it's meeting its requirements over a period of time. So it's really kind of important to realize that that's being done, because a lot of people just think that it's produced and then shipped out and going to the clinics. So what are some of the types of tests that we use in a quality control laboratory? So there's a wide variety of different tests. So it's everything from what we call physical and chemical methods all the way to biological assays. So for example, when we talk about physical and chemical tests, we talk about the ones that most people know about. So we talk about pH, we talk about osmolarity, we talk about human serum albumin quantification, and then we have what we call medicinal quantification. So these are those supplements, for example, like antibiotics like gentamicin or growth factors, heparin. Those are all considered additional medicinal supplementations. And you want to ensure that you have the correct concentrations that are present, so those are all doubly checked as part of the QC aspect. And then we have what we call microbial. So when you think about microbial, you think about the obviously sterility, you talk about endotoxin, but then more importantly, we look at microbial identification. So for example, if there was some type of microbial growth during a sterility outbreak, we want to be able to go back down and do the microbial identification because that helps us determine the root cause and so that it prevents a future contamination later on. And then, like I mentioned before, there's the environmental monitoring. So it's obviously monitoring the air, and then we have obviously the monitoring of all the water and the source of the water. And then we also, like I mentioned before, talk about the personnel monitoring, which I think a lot of people forget about because honestly, people are probably the main culprit for a lot of contaminations in all our laboratories. Then we have what we call the functional assays, or what we call the biological assays. These are dear to my heart because these are the ones that I do a lot. These are the mouse embryo assay, the sperm motility assay, and these are actual assays that utilize a biological aspect. So whether it's using human sperm to determine if the media causes a decrease in viability or a decrease in motility, or the mouse embryo assay where the media would actually cause a harm to the mouse embryos. Then we have also the QC laboratories play an important role in what we call investigations of anomalies. So for example, if we are getting abnormal results when we're looking at some of the data, we can help do the actual root cause analysis, and then we can help with some of the kappa investigations. And then another part that the QC laboratories function in is obviously we do what we call verification and validation of either new, can you hear me okay? Yep, okay. They either do new validation or verifications of either new equipment that's being produced, so we validate it and we verify that it's functioning properly. And then we also work with some R&D aspects. So why did Cooper decide to kind of bring a lot of their quality controls in-house, right? And that's what I'm here to talk about, the two different laboratories that have come online. So the main reason for consolidating is obviously what we call having the internal teams being able to perform the majority of the testing. So whether that's all the testing of the raw material, the in-process controls, and the biological assays, it allows us to be able to control the data that's being produced, but it also allows us to react more quickly if we actually see some anomalies. So the main point of in the internal consolidation was obviously to respond in more quickly if there's any deviations either in pH or osmolarity. We can be able to go back and see where these issues occurred, and then we can work very closely with the production team to say, hey, we're seeing this unusual reading. Can you go back and look to see at your records and so forth? And it just allows us to communicate a lot more quickly. It also allows enhanced data security and traceability. So all the data belongs to CooperSurgical. So if there is an issue, we can go back and look at all the records and see, okay, where something had occurred or who was touching who. We have really good traceability and so forth. And then obviously this allows us a faster turnaround, which allows us to get our media and our products out to our clients a lot faster. So for example, if we were outsourcing, you do what's called first in, first out, right? So we're kind of waiting in the queue. Now that we have the internal laboratories, we can pretty much test everything as soon as it's produced. So I'm going to talk a little bit about the two laboratories in detail. So the first laboratory is the one that we have in Costa Rica. So it's right outside of San Jose, Costa Rica. And they're generally doing a lot of the what we call physical testing, and they also assist with the in-process controls. The nice thing about this QC laboratory, it is in the large facility where the media is being produced. So there's a lot of very good interactions between the production staff and the quality control staff. The QC staff in Costa Rica reports to me. I'm situated in outside of Houston, and I do travel frequently to that laboratory down there. So these are some of the tests that the Costa Rica laboratory are currently doing. So like I mentioned before, they obviously conduct all the environmental monitoring. So it's not just the environmental monitoring in the laboratory, it's all the environmental monitoring for the site. So they basically are controlling and quality controlling all of the site at this Costa Rica facility. We do the water testing, and this is kind of important because obviously water is the main component of all the media. And so there's an extensive water testing program for looking at bioburden, obviously looking for sterility, and testing some of the chemical compositions of the water. And that's all run through that laboratory. pH and osmolarity, obviously that's all for our media, so they will conduct the different types of pH testing. So for all the different families that Cooper has, there's unique ways to conduct the actual pHing of each of those specific medias. And then obviously all the medias that are produced have what we call specifications or specific parameters, whether it's for osmolarity or pH, that need to be met. They also do the medicinal quantification, so they are testing the albumin, they'll be testing the heparin, gentamicin, and insulin as some of our components. And there's extensive type of equipment that's done in that laboratory, whether it's HPLC and so forth, but it allows them to be able to ensure that the correct concentration of those supplements are added to the media. And then we do sterility testing. I just mentioned before, that's mainly for the microbial. The endotoxin testing at Costa Rica, they do what they call kinetic turbidimetric, which is a quantitative way of determining the level of endotoxin. It's really unique in the sense that it looks at the production of or the cloudiness of the production of a clot during the actual testing, and that allows them to be able to quantify if there's endotoxin present in the media or in the extracts if we're testing devices and so forth. And then we do what we call color clarity testing, and that's where we actually are looking at the color of the media to ensure, for example, if it has phenol red, that it meets the required specification for the color, and then the clarity is obviously to make sure that there's no particulate matter that's present in the media. So these are generally done by a variety of different equipment or a variety of different types of technicians. So as part of the QC laboratory, it's not just important to be able to do the production and then do the quality control for all the media for the release. There's obviously the need to improve our technology. And these are some of the examples of some of the potential new techniques that are coming through the QC laboratory in Costa Rica. So for example, when we look at color and clarity, generally that's done as a visual assessment. We all view colors differently, right? I look out and I see that may be turquoise that our staff is wearing. Someone may say I've been wearing a gray shirt or a blue-gray shirt. So using a spectrophotometer is a great way to actually quantify the color of the media. So for example, what you can do is put media in a spectrophotometer, it generates a number. That value will basically tell us this is the correct color for the media. It's quantitative as opposed to qualitative, so it's a little bit more stronger in regards to quality control. Then obviously standardizing, I mentioned before, we have multiple different families of media. There's different ways of testing those parameters or those families. So standardizing the way that we're currently testing. So one area that we're working on is on pH. So standardizing using one specific probe and doing all the actual specifications as a standard way. And then there's what we call dry chem analyzer. This is a great new equipment. What it does is it allows us to actually get down to the chemical compositions of the media. So we can take a small subset of our media and then place it in this machine, and it can generally spit out pretty much the data of what the composition of the media is, and it ensures that all of the correct components are present And then we're talking about also speeding through our sterility testing, which is generally a manual process that's kind of a long method, generally about 14 days. So we are looking at new technologies to help turn around that time, and again, allow us to have a faster throughput and get the product out to our clients. So the other laboratory that I'm going to talk about is our new bioassay laboratory. This is where I'm situated, which is outside of Houston. It's actually in Sugar Land, Texas. This laboratory went live in November of 2024 and then began testing product in December of 2024. This laboratory basically is running all the biological assays that we have. So for example, we're running the mouse embryo assay, the sperm motility assay, and then we also do some endotoxin testing. We utilize what we call the gel clot, but we are also incorporating the kinetic turbidimetric. And then so I'm sure many of you are aware, but these are some of the assays. The mouse embryo assay, for example, is utilized to ensure that there's no toxicity in either the extract from the devices or the actual media that we are producing. So you expose the mouse embryos to that media or the extracted media, and then you look and assess embryo development, and a specific amount of embryos have to reach the blastocyst stage in order to ensure that the test is passing. Sperm assay or sperm motility assays work the same way, except that we just generally expose human sperm to those assays as opposed to the mouse embryos. And then, like I mentioned before, endotoxin is just a way to expose the media to these lysates that are produced from horseshoe crabs, and it allows us to determine if there's the presence or absence of endotoxin. So for the mouse embryo assay, this is an important assay because the FDA requires us to test all our products. So the traditional approach is basically to look at the morphology of the embryos, and to basically look to see how many one-cell embryos that we put into the culture media, and then we look at how many blastocysts that we have. Again, this is kind of dependent on the technicians that are running the assays, so we're always looking at ways to kind of improve this assay. So we have been requested through the industry to look at ways to increase the sensitivity of the mouse embryo assay. So for example, instead of just looking at it morphologically, there's ways that we can go down deeper into the embryos to ensure that we're getting the best quality embryos. So Cooper has been investing a lot of time and research on doing a bunch of different types of modifications to the mouse embryo assay, and we're hoping to start sharing that information at a future time. One of the things that we have actually evaluated when we first set up the laboratory is basically the strain of mice. My background is in animal reproduction, so mouse embryology, I've been doing it for over 14 years. So we've been looking at the different types of strain. So a lot of people don't realize the mouse embryo assay is not just something that you grab a bunch of mice and then you collect the embryos and then you do your actual assay. So a lot of work and a lot of research goes through to determine the type of strains that we're using. So these are just some examples of the different types of strains that have been used or could be potentially used in the mouse embryo assay. And so we are actively investigating, and we have a lot of good data that shows that there are actually differences in the type of strains of mice that we utilize or associate with the mouse embryo assay. And so obviously for the human sperm survivability assay, that same process works the same as with the mouse embryo assay, except that we actually expose human sperm to either the media or the extracted media. There are no real strict guidelines from, like, for example, from the regulatory bodies in regards to the sperm motility assay, but Cooper has developed specific specifications and abides by those. So these are some of the examples of the different types of assays that can be exposed or can be conducted when exposed to human sperm. So for example, we do the sperm motility assay. That's where we're looking at differences in the motility from what we call time 0 versus the time 24 hours after exposure. We can do what we call functional tests. Those are where, for example, we have a product such as PVP, which is used for ICSIs, where we're trying to slow the sperm down. So we can actually assess the difference between the pre-exposure and post-exposure to that media, and we can actually calculate the differences in velocity. So we are able to do a lot of these testing. We use a CASA system, which is a computer-assisted sperm analyzer. The system that we use is basically an FDA compliant. That's kind of important because, like I mentioned before, the QC laboratories are also important for research and development, and this allows us to be able to have all the equipment that would be FDA compliant. So if we did have to develop new product or new technologies, we'd be able to do that very easily. So one of the other things in regards to quality control, Cooper has implemented what we call a laboratory information management system, or what we call LIMS. And LIMS is basically a computer program that allows us to enter all the data that we have in all the laboratories. So for example, our quality control lab in Costa Rica is doing all of the physical testing, and then the Houston laboratory is doing all the biological assays. We can dump all the data into the LIMS, and we can be able to see everything in real time. It also allows us to be able to pull out our data and assess all our KPIs, and so we can look at trending, and we can start to see if there's any deviations in the actual data, and we can address it accordingly. We're also in the process of getting ISO 17025 accreditation. This is kind of important because this is kind of the gold star standard in quality control. So having that accreditation allows us to indicate that Cooper's laboratories, both quality control laboratories, meet those requirements. It's also important that it allows us to be able to do GLP studies, which are kind of important if we're, like I mentioned before, trying to do new product development. One of the other things that we do in the QC laboratory is we have continual quality assurance. So like I mentioned before, the fact that we're internalized now, we have that capability of being able to talk to the different types of the departments. So for example, we can go and walk over and speak to production, or we can go over and talk to quality assurance to ensure that the product that's being released meets all of those specifications. So we work very closely when we're doing internal audits, or when we're looking at what we call CAPAs, which are corrective action, preventative actions. And then we also are an important part in the management reviews for the site production. And then finally, like I mentioned before, we cross-function and collaborate between many departments, whether it's the production, R&D, or we work with a center of excellence sometimes if we're going to supply embryos or things like that. So we have that cross-functionality to be able to work with all the different departments. So Cooper has invested a lot of time and energy in ensuring our quality to commitment. So we are making sure that we're delivering safe and consistent high-performance embryo culture media. We're also being able to test any of our devices that you may see out here in the booth. They come through our laboratories, again, to ensure quality control. We uphold the strict quality control standards by supporting the ISO 17025 standards in our laboratory. Even though the accreditation hasn't officially occurred yet, we still developed all of our laboratories to keep up with those standards. And then obviously we are continuously improving and focusing on newer technologies. So whether that's ongoing validations or optimizations of our current QC assays and the equipment, or the overall processes that ensure that the product that we're releasing meets the highest standard. And then we obviously devote a lot of time in our staff. So we're continually training our staff in new technologies that are out there, bringing new research to the laboratory, new literature, new journal articles, so that they're kind of up to date with all that's going out in the industry. And then that's a great way for us to be able to attain scientific excellence, but also to be responsive to any new challenges that may come up in the industry. And then obviously we have our ongoing research and development, which is kind of important for any company to ensure to stay stable and to meet the needs of our clients. Any questions? Thank you.